a fairly simple and quick way to pinpoint the actual diagnosis from among these various possibilities. Your endoscopic procedure should cause only a small amount of discomfort because physicians normally administer some medicine before the procedure begins. This medication will reduce your anxiety and help you relax. You will be lying down during the procedure, and a rubber mouthpiece will be placed in your mouth to keep it open and to protect your teeth. Your mouth secretions will be suctioned just as they are during dental procedures. The physician will gently place the endoscope in your mouth and guide it to the back of your throat. As you swallow, the endoscope will pass into your esophagus. Sometimes it takes several swallows to do this, and it may cause you to gag for a moment. The endoscope will not interfere with breathing because it does not obstruct the airway. Just relax and breathe regularly. The physician will slowly advance the endoscope down the esophagus, inspecting all of its lining. To make the walls of the stomach easier to inspect, the physician will introduce air through the endoscope to inflate the stomach. You may feel a little bloated when the physician does this, but that is perfectly normal. After looking at the lining of your stomach, the physician will inspect the duodenum, the first part of the small intestine. If the physician sees an inflamed area or anything unusual during the exam, a small piece of tissue or biopsy may be taken at that time. You will not feel the biopsy or realize it's being done unless the physician tells you, but these tissue samples can provide important clues to your diagnosis. The physician will complete the examination by inspecting the entire upper GI tract again as the endoscope is slowly withdrawn. There are some potential risks of endoscopy, although they are exceedingly rare. The most important are bleeding from biopsy sites and tearing or perforation of the gastrointestinal lining. However, endoscopy is one of the safest medical procedures you can have. Most patients experience only a minor sore throat following the procedure. To make sure that your procedure goes well, there are a few things that you should do before arriving at the physician's office for endoscopy. First, do not eat or drink anything after the midnight before your examination. Tell your physician if you are taking any medications, especially aspirin or blood-thinning drugs. The physician will tell you whether or not to take the medication on the day of the procedure. Make your physician aware of any of your allergies to drugs and other substances. If you wear dentures, mention this to the physician. Your dentures will need to be removed before the procedure begins. If possible, bring a responsible adult with you. You may be drowsy and need help in getting home. Above all, if you have questions, ask for answers. Don't hesitate to call the physician's office before or after the procedure.
I did have a biopsy. The doctors did tell me that they were going to do a biopsy, and I didn't feel it. I was very surprised because they took a piece of my intestines, but it was painless.
I remember being able to eat a few hours after having the endoscopy and didn't suffer any problems because of that.